In this video tutorial, we are going to explain how to use the specialized clinical record for COVID-19 patients. So first we are going to log in into our system. And the first thing that we may have to do in the new OpenClinic system is to activate the three different clinical data entry screens that have been developed for COVID-19 patients. We can do that here in the system menu, configuration, and then this option, Department Examinations Administration. And then we have to choose a department for which we want to activate these data entry screens. We have a specialized department that was created already here, which is COVID-19. And I can then modify the content or the different data entry screens that will be available for that department. In OpenClinic, there's a whole lot of different specialized data entry screens for all kinds of clinical purposes, but at the bottom we will see that there is a surveillance section with the three new COVID-19 data entry screens. The first one is the COVID-19 triage screen. We can preview it here, and which will in fact offer information that will be relevant for patients coming into an emergency department and where triage data have to be collected. We have a second screen, which is the consultation or admission screen, which is intended for patients that will be admitted to the health facility. And then there's also a follow-up screen for following patients that have been contaminated and that have to stay at the health facility for follow-up, and where we want to keep track of all kinds of parameters while treating these patients until they get better. Okay, let's first, once we have activated these data entry screens, we will be able to use them in patient records. So let's first select the patient here. We have to make sure that we have an active encounter. I will use a shortcut here to create an active encounter. And then I also have created a number of shortcuts here for creating or opening specific data entry screens. The one for triage, one for consultations, one for follow-up of the patients. I could also access these data entry screens with this white page, and then I will see that in the department that I had created, I have these three screens available. Let's start with the first screen. The first screen is the triage data entry screen, and I could add a new one here. And basically, when no data has been provided yet, we have someone who does not have to be tested, and for whom we don't have to take action. In fact, based on these basic information elements that can be entered in the triage screen, the system will formulate two kinds of advice. The first one is whether to test or not the patient, and a second advice is related to the action that has to be taken. So if I will fill in a number of data elements here, like a fever, a respiratory rate, you will see that automatically these advices will change according to the information that I am providing. When I put a high temperature here, it will automatically activate the clinical sign fever. When I put a high respiratory frequency here, it will automatically activate difficulties for breathing. But we see that by default, the patient does not have to be tested yet, because we are keeping our test kits, and we don't have enough test kits quite often. We are keeping our test kits for patients that have additional important risk factors. Patients that don't need hospitalization, so admission to the hospital, because they don't have very severe signs or symptoms, it can be treated at home, and they will have to be kept in quarantine until they have been symptom-free for at least 24 hours. When I would have a patient here with underlying conditions, automatically the system will then say, okay, here we should perform a test for the SARS-CoV-2 virus. And when we would also have severe signs, the system will also give advice to hospitalize the patient. So it's really very quick to activate or to fill in this kind of form, which makes it very well suited for triage purposes. And I could then save this triage form. The second form would be the form for consultation and admission. Again, we will see similar data elements here that can be filled in, but it starts here with a number of clinical signs and symptoms. So these are the symptoms with which the patient is being admitted to the hospital. The same easy to fill in click interface that is being used. So we will just fill in a number of signs and symptoms here, like this. And then we can skip or go to the next section, which contains epidemiological data. These are data that are quite important for health policy making and for follow-up on a population level. So we want to keep track of patients that had contact with other people, with other persons that should also be checked for contamination, and where we should try to keep track of the complete contamination chain that starts from a specific patient. So the same easy to fill in interfaces here. We also want to keep track of possible contacts between humans and, or the patient here, and animals, because we know that there is an animal, there are animals as an origin for this kind of infection, being bats, snakes, camels, and other types of animals. And we also want to keep track of pre-existing conditions, pretty much the same data entry screen here as for the triage section. What has been added here is another section where we can calculate the risk or the probability of having hemophagocytic syndrome, which is a very severe complication of COVID-19, and that is leading to high numbers of mortality in intensive care. And based on a number of clinical parameters, being here the temperature, but also these other elements here, if the patient has hepatomegalia or splenomegalia, hemoglobin levels, white blood cell levels, platelet levels, ferritin concentration, etc., it will automatically calculate the risk of presenting hemophagocytic syndrome, which may be an indicator for applying immunosuppressive therapy, although it is by default contraindicated for this kind of virus infections, but it might be life-saving for a patient presenting this kind of severe complication. And there's also a number of links here to literature that has been published on this topic on PubMed. And then once we have admitted the patient, we can follow up the patient in the health facility using the follow-up screen. This follow-up screen contains a subset of the previous screen with the vital signs section and also the clinical signs section. And then also this the same section for calculating the H-score or the probability of having hemophagocytic syndrome. When we would have a patient that is symptom-free, if I would click no everywhere here, like this, so no remaining symptoms, and that the patient would be symptom-free for more than 24 hours, then automatically the system will indicate here that the patient is cured, is to be considered cured, and he is going to compare with the latest follow-up screen of for COVID-19, which was also symptom-free here. And then the patient can in fact leave the hospital, but of course will still have to remain in quarantine for a week or so, because the contamination risk has not disappeared yet. So this is a summary of the different follow-up screens that we have, or the specialized clinical record that we have for COVID-19 follow-up. It's worth to mention that the content of these data entry screens is compatible with a number of surveillance, epidemiologic surveillance tools that are being used worldwide, such as SORMAS that was developed in Germany.